Hi, my name is Nancy Bartlett, and I am a family nurse practitioner student at United States University. Today is November 20th, 2025. And for transparency, I'm going to do a quick 360 of my room. Just keep in mind, I am a travel nurse and I live in a fifth wheel. So kind of tight space, okay? Okay, we're back at the starting point. So I'm going to show you the ceiling. And there's not a very big ceiling. And what little floor space there is you're seeing it. Okay. And I have a space that I'm going to tuck you up on. Hopefully you don't lose sight of me. I'm still here. Okay. All right. Now that you're up there, I can continue. This is an abdominal exam that is recorded. It will be uploaded to YouTube for grading purposes, educational. Do I have your consent to do that?
Yes.
Great. All right. We're going to get started. So can I get your initials for identification purposes?
JB.
Great. And JB, how would you prefer I address you?
Jamie.
Okay, great, Jamie. Like I said, in the consent portion, we are going to be doing an abdominal exam today. And before I get started, I'm just going to get washing my hands out of the way, okay? Put that over there. All right. So before we get started, I do have to be able to see your abdomen. Are you okay with removing your shirt?
Yes.
Okay, great. And I'm just going to have you go ahead and lie back. And I have a pillow here just for your comfort to keep your abdomen nice and relaxed. Just so you're aware, an abdominal exam does consist of 4 portions where we're going to be looking, which is an inspection, listening, which is auscultation. I'm going to do some percussion, which is just some light touching with tapping, and then of course some palpitation, both light and deep. Do I have your consent to proceed?
Yes.
Okay, great. So the first thing I'm going to do is just look at your abdomen, and I see that your abdomen is nice and flat. It's very symmetrical. I don't see any scarring or striae. I don't see any rashes or lesions, and I don't see any vercosities or hernias either. I don't see any pulsations or any peristaltic waves. I see normal skin tone, and sclera is non-icteric. The next thing I'm going to do is listen to vowel sounds with my diaphragm, okay? So you're just going to feel my stethoscope touch your abdomen lightly, okay? I'm listening for vowel sounds with frequency and character, looking to see if they're normal, hypoactive, hyperactive, and yours are all normal vowel sounds. Next, I'm going to turn that over on my stethoscope, and I'm going to utilize the bell, and I am going to assess for vascular bruise, and I'm going to start at the aorta. And I'm going to move to the left and right renal. Left and right iliac. And for educational purposes, I am not going to expose him, but I would also assess for femoral, which would be right in this area. And there are no bruises noted. The next thing I'm going to do is I'm going to use my hand and, like we discussed, some light tapping. Okay? Mm-hmm. And as expected, tympanic sounds, which is a normal finding. I'm also going to assess the bladder. The bladder is also tympanic, which is a normal finding. Should we have found dullness, that would have been a concern for distension. I am also going to percuss over the spleen, and I'm going to start in Traub's point. Which is tympanic. And I'm going to move over to Cassell's sign. And I'm going to have you take a deep breath in. It is tympanic, so no indication of enlarged spleen or splenomegaly. Next, I'm going to assess for liver size. So I'm going to start mid-clavicular, and I'm going to find abdominal tympany first. And I'm going to move up until I reach liver dullness. I would place a mark there. I'm going to start again from mid-clavicular at long resonance and move down until I find liver dullness, and I would make a mark there, and that space between would be the liver size, which should be somewhere between 8 and 10 centimeters for an adult, which is a normal finding. So next, we're going to move to light palpitation. But before I do that, Jamie, have you been experiencing any abdominal pain?
No.
Okay, great. So what I'm going to do is light pressure in all quadrants again. You're going to let me know if you have any tenderness or if anything bothers you. What I'm really looking for is rigidity, guarding, and tenderness throughout the abdomen with just light pressure. Great. Completely normal findings, no guarding, no rigidity, and no tenderness. So the next thing that I'm going to do is I am going to do deep palpitation. I'm going to be looking for any kind of masses and any kind of rebound tenderness. So I'm just going to press a little deeper, and you're going to let me know if when I let go there is any kind of tenderness that you're feeling, okay? Mm-hmm. Deep pressure now. Doing okay? No tenderness anywhere. Great. So no masses found, and no rebound tenderness noted. The next thing that I want to do is assess the liver. So I'm just going to come up here. I'm going to have you take a deep breath and let it all out. And The liver edge is smooth. Any tenderness? So non-tender, appropriate size. So that's a normal finding. I am also going to palpate the aorta. And so midline, just left to the midline, and I'm going to feel that, and feels appropriate size and negative expansion past the midline. So that's a normal finding. I am also going to palpate the spleen. So once again, when I ask you to take a deep breath, I'm going to need you to do that. So go ahead and take a deep breath and let it all out. And no splenomegalia noted. I would also assess the abdomen for ascites, and I would do that through shifting dullness and a fluid wave test. And that would help us assess for that. The other thing that I would like to do is the McBurney's test, and that's going to assess for any kind of appendicitis or anything like that. And so that's about 2/3 of the way in line with the umbilicus, and I'm just going to apply some pressure. Any discomfort?
Nope.
Okay. I'm also going to do the Murphy, and that Murphy's point, and that's going to be up here at the costal space, and I'm just going to have you take a deep breath in and let it all out. Any pain?
Nope.
So that could be assessing for any kind of gallbladder involvement. The last thing that I would like to do is have you sit up, if you don't mind. And I'm going to assess for CVA tenderness, so I'm going to find that point. Any?
Nope.
Nope. I would also, for educational purposes, I'm not going to because of the limited space that I have, but I would also assess the other side. So no CVA tenderness noted. His abdominal exam is within normal limits. It's perfectly normal. I would wash my hands before leaving the room again, and thank you for allowing me to do this with you. And that concludes my abdominal exam.